to have a holistic view on any organization. Right?
محمد.
Yes.
رشاد هذا ما تزوجش والكذب مش حصل.
Excuse me?
No voice.
Okay, thank you. So as I was explaining, we have a holistic view now. So we Can you hear me again? I hope so. Yeah. So we have a holistic method now that can help an organization on any level. But we do this very practical. We go to the Gemba, we work with your leaders, we work with your workers, we work with your team leads, your frontline managers, all in order to create this continuous improvement atmosphere and culture, if you will. And we can do this worldwide. We have worldwide, some of the organizations we work with have branches or plants or whatever in different countries, and we can always help them from the same mindset with the same materials in different countries. Like I said, 600 consultants in over 50 countries worldwide. So that's about me and my company, and I'm happy you are still here. Let's dive a little bit into Kaizen in healthcare, because it's a little bit specifically different from other markets or segments, and we've developed some ideas about how to do Kaizen specifically in healthcare. One of the things that research shows worldwide by different organizations like PricewaterhouseCoopers, Gartner, who are doing this extensive research, is that healthcare is going to change. Right? Instead of you go to a hospital, you go to the doctor, and you just pay what he asks you. So the price is determined by the delivering organization. We are moving towards a place where healthcare will be value-based. So it will be the patient or the customer will be paying based on the quality of the result that is delivered instead of the service. Right? Do I pay for every visit to a doctor, or do I pay because because my health improved? Right? We see this in lots of markets, but in healthcare, this is something that is definitely going to develop and change over the coming years. And as you saw in the Kaizen principles, our first principle is knowing what is value for the customer. So this is the first step where actually Kaizen can help. Doing Kaizen can help in understanding what is actually value for your patient, value for your customers, value for your organization, and value for your employees. And so we need to develop together an integrated vision of what satisfaction in healthcare means. And this change is really going to be profound. It's going to have a huge impact on how healthcare will be structured and how we will look at healthcare in the future. And the most important trends in this, we think, from research we have received, is that healthcare will change to a patient-centered approach. Now, often the healthcare service is organized with the healthcare industry at the core, and the patient is kind of the patient is sometimes more of a victim of the process in healthcare, creating a lot of waiting times, uncertainty when you go to the hospital, uncertain when you will be serviced, how long you have to wait. So we have to turn that around. patients will never be a happy customer if they have to be waiting 24 hours to get serviced, right? And all of you know probably the packed waiting rooms in the hospitals worldwide. Certainly, I've seen them in Riyadh, and Kaizen is a way of actually turning that around, creating a different mindset with staff in the hospital, and creating different processes so that the patient can be at the core again. We of course need to support that with digitalization of the process. Every information about the patient, every information about treatment, every information about the medicine should be readily available at the point of access where it's needed, where the physician is working, where the patient is entering. Third one is telemedicine. So during COVID, we saw this a lot, something new. It was also new in the consultancy. We thought we need to be at the customer side to do our services. Actually, a lot of our services could be done remotely, right? Through MS Teams or through Zoom, like now. And also medicine sometimes will be going through this kind of platform. You see now apps emerging that will help you with your first self-diagnostic. You will see apps that, besides the self-diagnostic, also offer direct contact to a physician, but then remotely. That is something that is going to grow. And next would be automation and artificial intelligence, right? Operating rooms with robotics in the patient care areas. Actually, my daughter is working in a hospital here in the Netherlands, and already we see the first kind of robots emerging in hospital services with bed patients, lifting or administering drugs. And one important area that is often overlooked in healthcare is the supply chains within healthcare. I would say even the supply chain in one hospital is something already very complex that really needs some attention with regards to Kaizen and making things flow, making sure that there's no obsolete stocks, there's no waiting time for medicine, that there's not too many runs to move patients or materials around. So there's a lot of things to look at. We say from that, right, the current state of the world after COVID, and it still has a big effect on everybody. I'm traveling a lot. I'm still wearing masks, making sure I get my shots. And all other areas in healthcare will be, I think, reshaping because of what we've learned during COVID. So let's look a little bit deeper into patient flow, resource efficiency, integration and digitalization, agile planning, and logistical efficiency. Here I want to make one small remark. Kaizen is not a digitalization company. So the other process subjects I'm happy to cover, and we'll also touch a little bit on integration and digitalization, but we often cooperate with companies that are very good at doing this because we are a process continuous improvement consultancy, not an IT consultant. But nevertheless, let's look into patient flow. Patient flow is when a good patient flow means that when a patient arrives at the healthcare institution, he gets helped immediately with the kind of service that he needs with an excellent result, right? And now we see that on a global scale, and this will differ from hospital to hospital, I'm sure, but about 3/4 of the time that a patient is in a healthcare facility, it's actually waiting time. Waiting to see a doctor, waiting to get his medicine, waiting to be transported from the patient room to the operating facility or to the X-ray facility or whatever, right? So they're mostly waiting, and this is the reason behind this is that we are organized as healthcare with ourselves in mind and not with the patient in mind as the main object of flow and main object of the process. And by saying with ourselves in mind, I do not mean that healthcare institutions don't have the best intentions with regards to patient care, but every process is organized around how the building is structured, where my resources are, what the doctors think are important for them, instead of this patient flow in mind. And to really reach new levels of patient satisfaction, we need to break the silos down in a hospital, where after every step in the diagnosis, when you need to go to a new doctor or a new department, you need to make a new appointment, need to come back later, need to wait again, right? We should think of a way where we can put actually the patient at the center. This is a big paradigm shift in a lot of healthcare institutions, and that's the toughest one that we try to help with. Right? We try to redesign layouts. We try to certainly redesign the physical flow and the process of transporting and moving people and means in your healthcare institution. The second one we need to talk about is resources efficiency. What you see in healthcare, overall, in a worldwide, cost of healthcare is going up, is rising tremendously. And this is often because instead of thinking how we can make processes simpler, more efficient, more effective by making it more patient-centric, we often just add resources to make sure that we can still help all the patients that come to our door, be it because of new illnesses like COVID, or be it because our population is getting older. The thing is, we always just hire more people, buy more machines, right? And turns out that, again, on a worldwide scale, about 30% of the expenditures are used to hide inefficiencies in the process. And we need to really look again at the processes to reduce the waste, reduce of waiting, reduce of transport of materials, reduce the motion of people, reduce the amount of inventory and the loss of overstock, reduce the number of small mistakes that we need to that you not obviously see, but that we need to correct, and that will take time and money again. So we need to take that out. And in all those activities now, you see that about 30% of our expenditures are actually going, which is, in the end, if you're a private hospital, direct loss of in return on investment. And a lot of a new development from our perspective in healthcare is sharing digital information with the customer. And we know almost every patient think it's a very good, a very interesting, very important value to be able to access his or her patient information directly, right? Have access to their digital file, the medical file. Here in the Netherlands, that's very difficult. And I know Saudi Arabia, in a lot of instances, is a lot further with digital services to the civilians, right? To the citizens. All those platforms that make it easy for you to actually see your information, whether it's visa for traveling, taxes. I was very impressed with the system that you have there, where you can see your driver's license, see all your driving fines, see your visa for your family, see your COVID vaccinations all in one app, which is, must have been a tremendous effort and a great result. And that's something that I'm certain we can build on in healthcare in Saudi Arabia. The other one, the next one that I was mentioning was doing agile planning. Right? Agile planning means that we have a visual way of seeing, having insights in the capacity that is available at this moment, right? Whether it's nurses, whether it's beds, whether it's doctors, whether it is medicines, right? And we need to have to be able to plan in such a way that patients do not have to worry about waiting too much, about waiting too long for their treatment. We need to find a way to actually simplify the administrative processes and plan based on the standard process. If we have a standard process, we can plan every activity in a standard way with the patient as the center of the process, as the flow unit, if you will. And by centralizing, taking out the lower added value activities and centralizing them taking them actually out of the patient process, we can be much more reliable with planning and make sure that also from a business point of view, we are much better aware of how long patients will be in the bed, when a bed will become available again. All those things that are important to a hospital management. Agile planning can help us with creating a situation where medical acts are performed as planned, on time and in full, without mistakes, without rework, without unnecessary movement, and with a high level of satisfaction with the patient. Because agile planning will help us with being a predictable service provider. We already been talking about waste in healthcare, and I'm sorry, there's still more because and here's another one. A large portion of cost in a health institution is about taking care of the materials, right? Beds, disposables, medicines. And oftentimes we have a big inventory, huge stock, to make sure that you are able to deliver everything at every moment, at every given quantity. We failed to introduce until now the basics of logistics and supply chain management as we do in other areas. Right? You might treat the inside of a hospital with regards to the handling of materials a little bit like a supermarket, where they are very sharp on how much do I keep in store, which store actually needs how much of an inventory, which store needs what products, when do I deliver, how often do I deliver small portions, how long is my stock still valid, how do I prevent of stock going out of date, how am I going to make sure that there's there where it's needed. All these things that we can work on from a Kaizen standpoint of view, with the help of logistics staff in hospitals, to make sure that everything is available at the right place, right time, and at the lowest possible cost. any questions or discussions so far? Because I can't see you, so when I'm presenting to a room, it's much easier to see the participants' reaction and to work on that. I'm curious, everything okay?
Cool. How are you?
Okay.
Okay, very good. Okay.
Yeah, everything okay, good.
Any
questions now, gentlemen? It's better to, if any questions or continue, it's up to you, by the way. You need to continue now?
Yes.
Okay, Mr. Khan.
Yeah, I will just continue. Please feel free
continue.
to interrupt me, right? If there's anything, any question, please feel free to interrupt me, right?
Yeah, go ahead, no problem.
I just so because this was the things we learned from research in the healthcare market, reading articles, interviewing people, collecting data, mostly done by big research institutions like PwC and Gartner. I just want to give a small example of what it means to have a patient-centric process. If you look at this slide, it's about flow efficiency, right? And flow efficiency means that your product in your process, when you started working on that product, it is continuously being handled, continuously being developed. Every step there is some value added to that product until it finishes the production line, and the maximum amount of value is created and it can be sold to a customer. When you translate this to healthcare, you need to rethink about process and product. When we look at the example of Toyota, which of course is a car manufacturer, which is a big example in Kaizen and Lean, the car that is being built is actually the flow unit, right? We begin with a little bit of steel or iron. We shape it, then we attach wheels and a motor and windows and all kinds of stuff. And at the end, the car is ready. So the car here is actually the unit that is flowing through the process and gets a little bit of value added to it in every step. In healthcare, healthcare is a service, so it's a little bit different. And the flow unit in healthcare actually is the patient or the customer himself. Right? It's the patient that goes through different steps in the healthcare, in his personal healthcare process, from feeling ill, getting a diagnosis, being treated, to being healthy again. And the process might look a little bit like the picture on the left, where you have like a conventional healthcare unit, where this person, let's call him John, or you might call him Mohammed or whatever, he is experiencing some kind of pain on the chest, and he says, I might need to see a doctor. So he calls the doctor, makes an appointment, and he's lucky, so he can already come to the doctor on the next day, right? Or he goes to the hospital and sits there waiting hours because the waiting room is packed. And finally, after hours, he gets his first medical appointment. And the general practitioner will say, I don't trust this. Let's make an ECG. Then the patient will get a letter from the doctor, and with that letter he can make an appointment at the hospital to actually make his ECG. But he's only welcome after 1 week, right? And after 1 week the ECG is made, and then it will take time, maybe 2 or 3 days, to get his diagnosis on the ECG, and it will tell them, okay, now you need to make an appointment for a stress test. And again, it will take a week before the stress test is available, and you can go there. And then afterwards, it will take 2 or 3 days to get the results, because the one doing the stress test is not the doctor analyzing the test and sharing the results. But with all the test results, he can go back to the general practitioner, make a second medical appointment, and then turns out he needs an ultrasound. And only after 30 days, there's a clear diagnostic in this example. The idea of having a patient-centric process is more on the right, the integrated treatment clinic, where there's a standardized process for somebody to treat with chest pain. And they will know that if a patient with chest pain arrives, he needs to go through a first medical appointment with a clear question list, a checklist. Directly afterwards, he will get his ECG, his stress test, maybe have another standardized questionnaire to fill in, go for ultrasound, and get his diagnosis at the end of the morning, because there's a specialized doctor that knows from all these standardized tests and standardized procedures exactly what to do and how to come to a diagnosis. So after half a day, the patient is diagnosed and can go to whatever treatment he needs. Right? And these times are actual examples of healthcare processes as we see them worldwide, whether it's in a system like here in the Netherlands and in the UK, where there's a general practitioner close to the patient, and then later on he will be directed to a hospital, or where every patient comes directly to the hospital and but again moves from one specialist to another. And this is what we mean with creating flow efficiency, and the kind of result that we can make by analyzing the process that's going on and actually taking out all of those unnecessary steps, making appointments, waiting, and doing non-standardized work, and actually standardizing the work that's being done. And we often use this kind of picture to illustrate this. What we have actually done from the traditional clinic to the integrated clinic is taking waste out of the system. Waste is something we call muda. Muda is a Japanese word for waste, and VA here stands for value-added activities. And actually, the value-added activities are all those activities where the patient is direct in contact with either a doctor, with a nurse, doing something special, doing some medical analysis to actually create the diagnosis, which is the value added he needed in this process. Yes, Aldana.
Hello, Mr. Khan. It is great to attend this webinar with you this evening. My name is Adana Muammar. I'm an ex-healthcare professional.
Nice. Welcome. Nice to have you here. You have a question? Sorry, Aldana, I don't hear you.
Saladana? Can't hear you. Saladana.
Maybe you are muted?
No, just all check. By the way, continue, Mr. I will check it on this.
Okay.
She left.
Okay, so yeah, I will. Thank you. Hopefully she will be back. Instead of continuously adding resources and working harder, and therefore diminishing the efficiency of the process, right? We try to take all those muda, all those activities that do not add value, multiple registrations, waiting, transporting, moving from one part of the hospital to the other. In your medical cities, going from one building to another can be quite a trip that I've seen in Riyadh. Taking that out of the process makes it much more efficient, whereby value added can grow from, let's say, in the example, 50% of the activities are value added. On the right hand, after the lean approach, 75% of the activities can be value added. Right, so we can help much more patients with the same amount of people in the same amount of time. Too bad she left. Okay. So far, theory. Let's look a little bit about results. But before we go there, Kaizen Institute also has like an online university where we have a lot of small movies that explain a certain aspect of doing Kaizen. And I have a small movie now. She's back, I think. Is Aldana? Okay, I will show a short. Yeah.
Can you hear me? Yeah,
yes.
I was mentioning that right now in Saudi Arabia, we're adopting the patient-centered care, and we are trying to apply for the Plane Tree accreditation, if you heard about it. And it's focusing more on reduce the waste of time through the patient journey and the touch points of the patient journey, but it's not focusing on reducing the waste of the products or the waste of the inventories. So I think if we combine Kaizen with the patient-centered care, it would be a great process.
Yeah, sounds great. Exactly. That's exactly what we're talking about. Our Kaizen can work in small areas individually in an organization. But of course, the result is maximized when we are able to combine the different aspects of Kaizen in different areas in the same organization. Right? You get the best care in a hospital when you can make it patient-centered and make sure that all the materials, all the medicine, all the people are at the right point when it's needed there. So that's the supply chain or the logistical part of it. Yeah. So maybe that's something we can discuss later on when I'm back in Riyadh sometime face to face to see how that can be working. Looking forward to that very much. As I was explaining, so we have okay. Is Aldana? Let me show the movie. It's part of our Kaizen online university. Yeah.
Yeah, continuous. No content. Continue. Okay.
Yeah.
Yeah. I mean, I continue. Continues now. No questions. No, nobody. There's no questions. And right now.
Okay. Can you see the new screen? What does Kaizen feel like?
Sorry, can you see the screen?
You see now the movie, right?
Movie? No. There is the movie with you? No, nothing now. There is movie you want to show it?
I'm going to show. Okay, I will share another screen.
Well, nothing. Just try. Okay.
Yeah.
No.
I
Yes. Now. Yeah. Maybe now it's okay.
Okay. This is a movie. Yeah. So this is a movie from our Kaizen Online University, and it's a.
Yes. Yes. But there's no sound.
Okay.
No. You have now your picture.
Yeah, I know.
Still, yeah, no sound.
No sound? Okay. Normally, I'm more used to working in MS Teams, and then it works flawlessly. But I think
they'll tell you that it's about making things better.
Yeah, it's okay.
Yeah. Even with all that explanation, people are
still
left wondering. To begin their explanation with, it means continuous improvement. They'll tell you all about the good things that Kaizen can do. They'll tell you that it's about making things better constantly. But even with all that explanation, people are still left wondering what it is. Maybe the best way to help people understand is to describe what Kaizen would feel like. So let's pretend you're a devoted nurse and work in a small hospital that has embraced Kaizen. When you arrive at work, you check the wall that provides the status of all the other nurses and their patients, so you immediately know what's going on. An hour later, you notice that one of the newer nurses has put some instruments in the cabinet incorrectly. So you put a note on the Kaizen idea board to take 2 photos, the right way and the wrong way, and post it on the cabinet, a typical Kaizen technique. Your supervisor gets this done the very next day. Little improvements like this happen all week long by you and other people in your work group. Each week, you meet with your team to identify larger problems that require group problem solving. This week, your team starts working on saving time by organizing better care instructions for patients when they leave the hospital. Even though you explain home care in detail before patients are released, you get too many calls when they get home asking you to explain things to them all over again. Every few days, you notice one of the managers walking around the hospital and not just rushing from one meeting to another. They're spending time in the patient wards, in the labs, in the waiting room, in the cafeteria kitchen, in the maintenance area. And they're asking a lot of questions, trying to understand how things really work, how they could better organize things for you and your patients, and how to make your job easier with fewer frustrations. During one of your short daily Kaizen stand-up meetings, your supervisor reviews all the improvements that have been made in the last few weeks, just to make sure the improvements are being sustained. You're reminded how quickly new solutions can revert to the old ways if you don't make sure they become permanent. As you walk through other areas of the hospital, you notice that many of the departments are using the same techniques and methods that your department is now using. It's like there's this new common language that the entire hospital shares in making things better for the patients and the staff. When you and another nurse are taking inventory, you start describing your ideas for solving inventory shortages. She smiles and reminds you that the team hasn't even identified what the root cause is. And that's critical to know before you start brainstorming for solutions. You know she's right. Kaizen has taught you to attack root causes rather than just throwing solutions at a problem. As you get ready to finish your shift, you review your sign-out checklist to make sure that everything has been done, a key step in your process to guarantee quality, which reminds you of one of the most important lessons in Kaizen. Using good processes brings good results. You make a note to remind your children that getting good grades on their homework depends on the process they use to study. And that means it should not be done in front of the television. You remember what it was like just a year or two ago when there was so much wasted time, gaps in delivering quality care, miscommunication with the doctors, and quarrels with other departments. It's not perfect today, but it's certainly a lot better than it was. You understand that Kaizen is not a program, it's a way of life. And that's what Kaizen feels like.
So that's what Kaizen feels like. That's a little explanation of what you will see when Kaizen is working with you in your hospital or pharmacy or any other healthcare institution. Right? You will see standardized work, cooperation, small, short cooperation meetings. You will find problem solving by doing root cause analysis, and therefore improving daily work step by step. You will see leaders on the shop floor trying to understand the process and helping where they can. And I think that's, that depicts in a very good way our approach as a Kaizen Institute, working with the people to make sure that we solve the problems that everybody experiences on the shop floor. We say we partner with our customers to build optimal solutions for everybody involved. To finish it, my presentation, I would like to show you some results. I will show you quickly some figures, but also some practical examples. When we're looking at healthcare, we're looking at general healthcare, hospitalization, ICUs, ambulatory help, pharmacies, emergencies units, outpatient or surgery units, but as we earlier discussed, also at procurement and logistics. And like in general, you will find better patient satisfaction. It's going to be much easier to collect all the fees. You'll have less information errors in your organization. When we look at hospitalization, the number of early hospital discharges will go up. So bed occupancy improves a lot. There will be less delay. People will be much quicker to check out of the hospital. There will be less waiting time for an appointment in the ambulatory part and in the outpatient areas. The turnover time gets shorter, throughput in the operation rooms gets higher, and in that way, waiting lists will get shorter. Right? In emergency, you will be quicker with triage because of standardization, and length of stay in the emergency room will go down. Again, making life a lot easier for the people working there, I know. And then in hospital pharmacies, you will much less out-of-date stock, reversals, but also much less out of stocks, because by keeping good data, you'll be able to predict much better what will be needed when. So you have to, your stock will be much more suited to your situation and your area. And for procurement and logistics, again, having less stock will so less inventory will automatically bring you less deviations, will cut costs a lot, and will also make you more flexible in responding to new requests. In general, we see that there's like 17% less information errors in the process, less visits, but also a 30% increase in patient satisfaction. length of stay will go down in the urgency and emergency rooms. There will be much less waiting time. And because of specialization and standardization, also the triage will get much quicker. After hospitalization and from the ICUs, it will take less time to discharge, because all of this process will be much more standardized. Standardized checklist, standardized times for the doctors to sign off. Maybe less signing off will be required. And then also because of better care, less mistakes, hospital discharges will be much earlier. And by not directly in the care, but in the process for the workers, for the nurses and the doctors, if you have a very good standardized shift changeover, you can do this much quicker, which leaves time for attention to the patient and for extra improvements. Similar things go for the outpatient surgery. The turnover time between patients can be much quicker if you have a good standardized way. You might need less rooms by having a better process. And your waiting list will diminish, or your waiting rooms will become empty because people will just arrive in time. Same thing in ambulatory. Because of better standardized work, not waiting for appointments, actually the effective time that your people work with for the nurses will be much higher percentage of the time they actually spend doing their jobs. In the pharmacy, you'll see less reversals, less out of stocks, and a decreased value. At the end of my presentation, I have some practical examples of what Kaizen Institute has done worldwide. This is actually an example from Canada, where actually the first things we analyzed when we started there was that there was a lot of moving around of patients depending on the kind of complaint they had when they entered the hospital. And by reorganizing, redesigning the hospital had grown over several years, and just every time something new appeared, they just added something to the building. And in the end, the organization was very, very inefficient. So we redesigned how all the different process steps were organized in the building, making sure that the patient flow was more logical and much shorter. So logistics staff had to move the patients less around. Also, same goes for the medicine and the doctors and the nurses. And that, in the end, freed up a lot of time. Later on, we did much other projects, but this is like a first example of how Kaizen can help with redesign of a process, even in a hospital. This is an example in Portugal, where for the diagnostics, the X-ray and the CT, where clients experienced a lot of waiting time. Turns out when we started there was no visual management to direct the patients from one area to another. So patients were confused and waiting a long time before they actually would be helped. And after we left, there was like a clear schedule and also clear directions where to go to, which reduced the waiting time for X-ray and CT scans actually by about a third. And patient satisfaction, which was also measured, went up by 25% just because they had to wait less to get their X-ray done. All of this amounted to a higher service level. The organization was much more efficient, so people would be helped much faster. In the same hospital later on, we were able to work on a patient-centric planning system where we helped them, instead of the difficult process you see on the top left, which is quite different in Portuguese. But a patient had to go through very many stages before they would be helped. A little bit like the early example I showed you on the slide, on one of my first slides. By organizing all the care around the patient instead of letting the patient move from one station to another. And what we added was the different communications channel that were where the patient could actually get their information from, which made their life much easier. We were able to, again, reduce waiting times for the patients, and also help that the customer satisfaction went up by a tremendous amount. This is for the help desk, like the communication from the patient with the internal logistics. We redesigned their process, taking a lot of waste out of the system, making it much more standardized, and having like a standardized way of communication with the logistics to get everything delivered. And also making sure that all of the requests were visible for everybody involved. We were able to help more departments by increasing the number of requests that we could resolve every day. And even by doing this simple activity, the team motivation went up by about 30%. And in another hospital there was a pharmacy we helped, and you can see from the pictures before and the pictures after that we focus mainly on what we call 5S, so organizing the warehouse. So it's very visible what is in stock, where it is, that there's a standard place for every type of medicine or material. And that helped actually reduce the stock and also the stock value, but also reduce the number of returns, because often wrong materials were delivered to the wrong departments. And all of this created quite a saving, also money-wise, in the hospital. In the material we presented before, you already saw the names of organizations that we've helped. I would be happy to take any questions. Thank you for listening so far. Thank you for your patience, and well, I hope you enjoyed it, and looking forward to your questions.
Thank you, Mr. Giacomo. Thank you. Appreciate it. Yes, any questions now? Any welcome. في طالع معنا الأستاذ الهيثم.
Hi. Hello, Haytham. Adnan, you raise your hand.
Adnan, تفضل.
Yes, yeah. Thank you really for the nice presentation and this today webinar. Just rise up in my mind, there's one questions. As you mentioned, 74 or 3/4 of the patient time in the hospital is in waiting time. Yes. So really from a practical view, in our practice, in daily practice, reducing patient time really always will be a challenge with patient safety. Because, you know, all the waiting time for the patient is rationalized for assessment for the patient, sometimes for the triage also, to be fair with the patient, and yeah, a lot of constraints really while we are checking or while we assess the patient streamlines and the process. So from your experience, how we can really balance between reducing the patient waiting patient time and also securing patient safety goals, really. This is what always we are facing in the practical day.
Yeah. Thank you for your question. Much appreciated. I think from my experience, the patient safety or personal safety should always go first, right? Safety for everything, right? So safety goes before taking waste out of the system. So if you're doing something specifically with the reason of patient safety, then that activity is not considered waste or waiting, right? So that is maybe not a direct answer, but so in that 74%, doing activities that are there because of patient safety is not considered waiting as a waste. Of course, we can be quicker, or we can reduce waiting time for the patients if we put like a small motor behind the bed and do like 30 miles an hour instead of 5 miles an hour, transporting the patient from one place to another. That would not be safe, and so taking that time is not considered waste. But waiting to be transported without any further safety restrictions, that would be waste. We would be looking for a way of making sure that waiting to be transported safely, that we would consider waste, and we would try to take out of the system. We would work with your staff to find the root cause for that waiting and take it out. Right? So most of the time that is because of unavailability of staff, unclear appointments, unavailability of doctor, or unavailability of maybe even operating rooms. So we need to find out what's going on. Why is that not available? And then we can certainly change it and reduce it. We strive for absolutely no waste, but we also are realistic and know that there always will be some waste, but we try to make it as minimal as possible.
Yeah. Thank you very much, really. Thank you. Appreciate for your sharing your experience in this area. Thanks.
شكرا يعطيك العافيه عدنان، وان شاء الله ترى احنا نستطيع ان نساهم معك ونعين معك في موضوع السيف تايم، يعني ان شاء الله when Mr. coming to Saudi Arabia, I will try to visit you. We'll see how can do to help you for this point.
That will be that will be our pleasure. And also we have different methodology. We are improving our service. Even we can, there is suggestion to be there is integrated between, for example, BMI project management also methodology. We have one good experience for that area in Corona time. We merge between Six Sigma and the BMI approach to develop a quick wins project within 6 weeks, maximum 6 weeks, just to overcome the challenge born by COVID time. And also this is we published also this our experience, and there is a list of lesson learned. So it's really will be a good time while here is the physically for Mr. Kon come to Saudi Arabia, also can physically discuss this area. Thank you for your time. Thank you. شكرا يعطيك العافية مهندس. شكرا.
Mr. Ayman.
Assalamu alaikum.
Good
night. I want to thank you about this highly valuable lecture. And could you please, I want to ask how to apply the 5S methodology that is driven from Kaizen approach if it is related to the lecture today about sort, strengthening, shine, standardize, and sustain. How can we apply it shortly in improvement of the healthcare quality and patient safety in hospitals? Thank you. Thank you.
Okay. Yeah. So 5S in healthcare or in a hospital is applicable in different situations. One of the examples I showed you was in the pharmacy inventory, but much closer to the patient care. You might do 5S by standardizing what materials you need in a certain I lost the word. Hospital in a certain hospital ward, depending on what kind of service. If you're in the orthopedics, you might need lots of bandages, plasters, stuff like that available. When you're in neurology, that's much less the case, right? So you organize, first of all, what kind of materials you need to have ready at hand at the certain care unit. Then you will have like a centralized inventory where you will have standardize your inventory by types of material, but also different stock sizes, optimized stock sizes for every type of medicine or material you need. And then on every next to every patient, you might have like a small cupboard with a standard content, which is highly standardized. In the movie, you saw this picture of a drawer with different kinds of scissors. And I'm not sure if you if you remember that, but in a standardized drawer next to the bedside, you would find a special area for a scissor, a special area for bandages, a special area for plasters, and so on, right? Maybe some small syringes, and making sure that is next to every bed, there's a standardized cupboard with a standardized content where you never find an empty drawer, where you never accidentally take the wrong stuff because it's so well organized. That would be 5S in a hospital situation. Is that a good answer to your question? I think you're muted.
Thank you. Thank you very much. Shukran.
Welcome. Welcome.
Okay. Any more questions?
مهندس تركي.
وعبد الله.
هي بس ما ادري دقيقة بس.
خلاص عندك يا ابو عبد الله.
Anybody questions? I can't see if anybody raised their hand, so
yes.
Please help me with that, Turkey.
Yeah. I thought nobody. Any questions, gentlemen?
I have a question in the chat, Engineer Turkey.
Okay.
The question is the Kaizen an approach using other improvements, tools like Lean Six Sigma, etc., or it is a tool standalone?
It is, if you remember in the beginning of my presentation, I told you it was we have a holistic approach. What I did not go into now is the Kaizen business system. And in the Kaizen business system, you will find Kaizen is an approach that is aimed at continuous improvement everywhere, every day, everyone. And some of the tools we use come from Six Sigma or from Lean. Where Lean is much more in the daily Kaizen, so in the daily small improvements area, And Six Sigma is much more, and also like PMI is much more in the what we call breakthrough Kaizen area, where we try to solve the bigger processes or problems or create breakthrough improvements that actually change the way the organization works in a big step. So oftentimes Lean Six Sigma, and Kaizen are combined.
Actually, I have a question, Mr. Cohen. We are with Mr. Turkey arranging this webinar. I have been working in the hospitals for almost 30 years. The main concern of hospital people, management, and medical staff is the congestion in departments, in ER, the flow, I mean, there's a lot, I mean, lots of crowdness, even in, I mean, wards, admission wards. So how can Kaizen would help healthcare organizations to improve the crowdness in different departments like ER, like the admission, ICU. In every and each department, there is a crowdness, lots of patients, delay of discharge, delay of doctor's visits, delay of lab tests, delay of x-rays, delay. So how would Kaizen help them to improve this process?
Yeah. So that's a really big question, right? and I will try to keep my answer direct. And the thing is, when you have congestion, whether it is in traffic, or it is in the waiting room, or it is in the ward, or in ICU, it is because of there's unclarity on who should be, who or what should be where and when. So we try to find a way of making sure that we work in a standardized way, and everybody, hospital staff, doctors, nurses, know what is expected of them, at what time and where. And for patients, also, we try to keep communication as clear as possible. So the most simple way would be, if I have a doctor that sees on a continuous basis patients for like 8 hours a day, and he can maybe help, like on average, one patient every 10 minutes. Some patients will take 15 minutes, other patients will take 5 minutes. We will always make sure that there's only coming 4 patients every hour. And we will look at a way of even telling those 4 patients at what time to arrive in the hospital. And by doing it like that, and doing our statistics and organizing the logistics for the patient logistics in such a way that it exactly fits, that is the way to solve the congestion problems for patient care. Right? Our goal is always an empty waiting room, by making sure that every patient arrives just in time to be helped by the doctor. What we see here in the Netherlands now is that oftentimes a doctor will have about 5 minutes per patient. So actually, we will instruct the assistant that makes the appointments to, let's say, make 3 appointments at 10 o'clock with 3 patients, then make 3 appointments at 10:15, 3 at 10:30, 3 at 10:45, 3 at 11 o'clock, right? And that way, nobody ever needs to wait more than 15 minutes. And there's never more than 3 patients in the waiting room. That already is a big gain from how it has been. And so that's the way we approach this. And then step by step, we make it more precise. but it takes discipline also on the hospital staff and doctor side, right? My experience, sometimes doctors think they are the ones that can decide about everything. But if you want to have a good patient flow, they also need to stick to the standards. I hope that answers a little bit your question.
Well done, Mr. Cohen. Well done.
Yeah,
It takes always lots of efforts to manage this problem.
Yeah.
Especially in our hospitals here in Saudi Arabia, always we have crowdness, always we have delay in ER patients. So I believe Kaizen would help a lot if the problem was studied very well by qualified and competent people, Kaizen competent people. They will find out the solution, and they will come up with a good modality to facilitate the patient flow, patient crowds, delay of doctors, delay of labs, delay of X-rays, delay, lots of issues, but that can be sorted out via Kaizen or by Kaizen. Thank you, Mr. Kuhn.
For sure, thank you. I see a lot of questions in Arabic. Unfortunately, I can't read Arabic. So please, Turki, can you help me with translation?
Yeah, no problem. There is a question. Mr. Ali, you answered this question for the certificate, no certificate from this webinar. الأستاذ مبارك الرشيدي طيب في ساعات للهيئة. هذه أبو عبد الله جاوب على السؤال هذا. هيئة أبو عبد الله
سم
في مكتوب هنا من الأخ مبارك في ساعات الهيئة ما هيئة الصحية من قصده.
طبعا هذا نشاط تعريفي ونشاط للمجموعات الصحة الحقيقة للإدارة الصحية والسباحي والGCI تعريفهم بالكايزن فما لها شهادات هي مجرد نشاط من شركتين شركة الشركة السعودية للاعتماد سيكا وشركة بصمات الإنجاز لتعريف المنتسبين والكوادر الصحية والإدارات الصحية بمفهوم الكايزن وكيفية عمل الكايزن في المنظمات والمنشآت الصحية.
Yes, this is يعني هذا Mr. Cohen from some gentleman he asked about this presentation. He presentation for just to make high awareness what means the culture of the Kaizen approach of the Kaizen. So this good mentality, I would change the mindset for the Kaizen. There is another question from Afaf. He asked, there is branches in Saudi Arabia for Kaizen Institute. This my answer, and inshallah, at the end of the year, there is a Kaizen Saudi Institute from Kaizen Institute, inshallah, end of the year, and you can take it all the courses and the 2OT and everything from this Kaizen Institute, Saudi Arabia, inshallah, at the end of the year. Right, Mr. Khan?
Yes, the planning is currently to have a new Kaizen Institute branch in Saudi Arabia, in Riyadh, somewhere later this year, and I hope very soon, Mr. Turki.
inshallah. طبعا الشركه السعوديه للاعتماد وبصمات الانجاز يعني الله يعطيكم العافيه ابدعتوا. اذا كان في سؤال اخر نحن جاهزون. اتوقع no question Mr. Khan.
Well then.
No question. So إذا كان في سؤال يا كرام نحن جاهزون. I thought no question Mr. Khan.
Okay.
Thank you Mr. Khan and I appreciate and as usual you do it the best thing and inshallah we'll see you soon in Riyadh and we'll make meeting with all the people for the Kaizen, for approach of the Kaizen. And Dr. Adnan, thank you. Dr. Ustad Afaf, thank you. Inshallah, we'll see you soon. Inshallah. شكرا أبو عبد الله صديقي وأخي الأكبر علي الرويلي بصمات الإنجاز على هذا الدعم الجميل. Thank you. وكل من شارك معنا في هذا الويبينار. Mr. Cohen, thank you. We'll see you soon, inshallah. And say hi to all your family and your country and John. We'll see you soon, inshallah.
Thank you.
وعبد الله عندك شيء بتضيفه الله يحفظك ولا؟
It's just one comment, if you allow me. The handout is going to be sent for participants only via email. Also, the SICA email will be in the handout. So, for any inquiries, any questions, you can contact Engineer Turki Liami directly and can forward it to Queen or Kaizen Institute to find out the proper answer, and then we'll get back to you.
Very good.
Thank you. Thank you. Shukran, Abdullah. Thank you, everybody. We'll see you soon, inshallah. Goodbye and good luck to all, and take care. And inshallah, we'll see you soon. Thank you. Thank you. Thank you.
If you please, the handouts will come to our emails for the participants.
Yes.
A lot of thanks. شكرا جزيلا جزاكم الله كل خير.
أهلا وسهلا شيخ أيمن. Okay. Anything?
No, thank you.
Take care and take care all the people, and we'll see you soon, inshallah. Bye bye.
Bye bye.
Bye bye.